Hey everyone, this is Dr. David, physical therapist with Paso Manual Physical Therapy, and I wanted to talk to you guys about carpal tunnel syndrome and other nerve symptoms that might appear in your arm that sometimes is mistaken for carpal tunnel syndrome. So just a real quick description of the carpal tunnel. Carpal means wrist, and tunnel, obviously a hole, a passageway. So in this region is where there's a little hole passageway in the wrist, and a nerve passes through their median nerve and it innervates the hand right here, some of the muscles and the sensation to there. And so a lot of people will complain that have true carpal tunnel syndrome will complain of numbness, tingling, weakness in this area. They'll actually have some of the muscles that look like they've wasted away, like they've atrophied. But what we tend to see is people get symptoms in other parts of the hand as well. They get numbness, tingling on the pinky side of the hand right here, into the ring finger sometimes, and then on the top of the wrist, forearm, and into the hand right here, especially along these three fingers. That's a different nerve. It doesn't pass through the carpal tunnel, but it can be set off as well. Now, we tend to find that a lot of these symptoms are related to problems up in the shoulder and neck area. So consider if you have any shoulder pain or neck pain along with the hand tingling, numbness, or weakness, that could be related. In fact, it might be the cause. So that's something that we look at with patients that have these kinds of symptoms. But here's some quick tests that you can do to see if your nerves are involved in your hand. Maybe it's carpal tunnel or one of the other nerves. So before you start this, make sure that you move slowly through the tests. I would watch first and then try it, because these tests can flare up your nerves, and I don't want to leave you in more pain, feeling like you might have to take pain medication or something like that. So just go up to the edge of where you might feel some stretching, pain, numbness, tingling, something like that. Don't push into it, please. If you find that you have some numbness, tingling, or pain in these tests, I recommend you go get checked out. This problem could become significantly worse if you don't do something about it. A lot of times it's related to a disc herniation in the neck or something going on in the shoulder as well. And the sooner that you get this problem corrected, the less time it takes, the easier it is to fix, and then the easier it is to prevent as time goes on. You can avoid doing some surgeries or having to be on medications for a while. So here's a test. Tuck your thumb into your fist just like this, and then you're going to turn your thumb down, straighten out your elbow, bring your arm back, and bend your wrist down. You shouldn't feel anything but maybe some slight stretching at the end of the motion there. But if along the pathway here you're feeling some pain, some intense stretching already, that's not normal, could be a nerve. Go get that checked out. Next test, open your hand up like this, turn your fingers towards your head, push your elbow out, and then start moving your palm towards your ear, just like this. You should feel just a little bit of stretching at the very end like this, but if you feel it just getting to right here, maybe some numbness, tingling, or pulling is another sensation people say they have, that's something to go get checked out as well. And then the last test is, again, palm open. This time your fingers point out, and you're gonna stretch your fingers down this way. You should, again, feel just a little bit of stretching at the end of the motion, but it shouldn't be overwhelming. So if you guys have any further questions or concerns about that, please give us a call, get in touch with us. We can certainly help you to address this problem. Thank you so much. Have a wonderful day.